Hi, it's Alexis, and welcome back to the concept of contraceptives. For today's podcast, we have a special guest, and I will have her introduce herself and how she contributes within the women's health industry.
Hi, Alexis. My name is Wendy Wetzel. I'm a nurse practitioner, and I have about a 45-year career in women's health in various aspects, both OB/GYN and some family practice.
Perfect. So what do you do right now within women's health?
Right now, I work with a group called Days for Girls, and we promote menstrual equity around the world by making washable menstrual products for girls and women in developing countries, and also teaching menstrual health education.
Perfect. Do you take volunteers for that?
We do.
Within Flagstaff? That'd be perfect. So we'll just kind of go about some questions here. So what would you say, how do you go about addressing topics such as contraceptives within like younger women or just women in general?
I find that as a healthcare provider, most women will make an appointment specifically for birth control advice. And I usually ask them if they have researched any methods, what appealed to them, what questions they had, and we sort of start with the method that they think they would like to use. And then from there we go over risks and benefits, ways of taking birth control or using another method, and to just get them acquainted with the method so that they're comfortable using it. The best method of birth control is the one that works for you.
Perfect. What kind of like pros and cons would you say for most of the birth control that some people take?
You'd have to almost go type by type.
Yeah.
Certainly there are major side effects with estrogen-containing birth control pills that include blood clots, can't be taken by women who have a breast cancer history or even a strong family history without additional testing. Pills have to be taken daily, so it has to be convenient for the woman's lifestyle. If she can't remember a pill every day, then birth control pills are not a good option, and then we move on to something else.
Would you say the pills are probably the most common that women go to?
By far.
Yeah.
By far.
I feel like it's probably the most, I feel like when going into the whole, what kind of birth control, we really only know about like what pills are. So I feel like the other options are kind of iffy for some people.
Well, it really depends, again, on lifestyle and preferences. We have to consider your lifestyle because if you travel a lot and forget your pills, then you're susceptible to pregnancy. So there are other methods that once the provider provides the method, like IUDs and Nexplanon, then we set it and you can forget it for the most part.
Perfect. So are there any other ways in order to support women who don't have access to contraceptives or even birth control?
Well, there are now over-the-counter birth control pills. They tend to be progesterone only. The downfall is you have to take them about the same time every day. They take the estrogen out of the equation, and there's only, a little bit less effective for preventing pregnancy. So that's always one option. More and more schools and universities are providing information with something over-the-counter like condoms, female condoms. Those are accessible to most people. Now, I did look into the county health department here, and they do provide a well-woman visit for $20.
Oh, that's nothing.
That's nothing compared to what you'd pay to go to a private provider. So there are always low-cost clinics. Planned Parenthood has for years had low-cost birth control services as well, and I know many of the students I worked with here use Planned Parenthood as well.
Yeah, I think NAU has a pretty, if you're going for a woman health checkup, I think NAU is only like $25.
It's very reasonable.
Yeah, it's not too bad.
Very reasonable.
What would you say about like Plan B? Do you think some people have access to that even though it's kind of on the pricier side?
Plan B can be pricey. The health department will provide it, and I read that Planned Parenthood also has it for very low cost. When we had a pharmacy on campus, it was $15.
Oh.
And also Campus Health here provides Plan B. if you make an appointment.
Okay. Is it just through like the women's health checkups or?
They've changed the system since I
Yeah.
worked here, so I can't really speak to that. But I know we had them in the pharmacy here for 15, and then the nurses were authorized also to provide Plan B to women on request. And also pharmacies will, and I would shop around. And there are plans you can get online, like GoodRx and Single Care, that bring your cost way down.
How long did you work on campus?
9 years.
9 years?
Yeah.
That's crazy. Did you enjoy it?
I did.
Yeah.
But it was time to retire.
So what are some examples of like emergency contraceptives, and how would you say like how effective they are?
They're very effective if they're taken correctly. Generally, the sooner you take them, the better off. And they're only made of one ingredient, which is progesterone, which raises the serum level, the blood level of progesterone. It also changes a little bit the lining of the uterus, and it can change the rate at which the egg and sperm move through the tubes.
Okay.
Okay?
Yeah.
So they're very effective, but you've got to take them sooner rather than later. And I saw many young college girls that said, oh my God, the condom broke last night. Get in here, I'll get you Plan B. And it is over the counter. And again, shopping and finding a prescription plan are really helpful for those. So they are very effective. When I was working as a sex assault nurse examiner with the county, we provided Plan B to everyone.
To everyone. Would you say that some women are kind of more like scared to go to find help, I would say? Because I feel like younger women are kind of like iffy about like finding help.
It depends on how they feel about their bodies.
Yeah.
And I work with a lot of menstrual health equity and education. And so the questions that we get from ninth graders are amazing. So I think we're seeing a new generation. Now, in my generation, because I'm old, in my generation, we would have just waited it out and hope we didn't get pregnant.
Yeah.
But now it's a common thing for the heat of the moment took over, the condom broke, they didn't use spermicide, they were drunk, whatever.
Yeah.
And so I think today's women, young women, are more open about it.
Do you think their sexual like health education is getting better?
I think it's getting worse.
Getting worse? How would you say that?
Well, I know that the school district here has suspended the PAST program and instituted a new program. And what I'm hearing from students is that the teachers who are providing this are reading out of a book.
Oh.
Rather than having interactive. And conversely, with Days for Girls in Coconino County, I was up at the Navajo Reservation a few weeks ago and was meeting with all the girls at one of the schools. And their questions were just amazing. So I think they're thinking about it, but a lot of schools don't even have formal sex ed anymore. And it certainly doesn't go far enough.
Yeah, I feel like when I was taking sex ed, it was kind of like what is a condom, what is sex, and if you get pregnant, go take Plan B, but that was it. They didn't really teach you about like IUDs or like non-hormonal contraceptives. Like it's still like kind of blurry in that area, I feel like.
I really think the curriculum needs to include all forms of birth control. And even though with Days for Girls I'm not supposed to teach birth control, when there are questions I will respond.
Yeah.
And I'll respond honestly. And one of the questions was, what if I have unprotected sex? You get yourself over to Tuba City Women's Clinic and you ask for the morning after pill. So there is a lack of education for the most part.
So do you volunteer to like go to these schools and
I
teach?
do.
You do?
I do. Days for Girls is totally voluntary.
Yeah.
And so we sew for them. We handed out washable kits, menstrual cups, did our whole education curriculum. And honestly, some of them didn't know how babies were made. And we had to go backwards a little bit. And they went, well, how does this really happen? I said, okay, let me back up about 6 slides here. Because we talk in depth about the menstrual cycle and when women tend to be more prone to becoming pregnant.
So So what made you like jump into this type of field?
Women's health in general or Days for Girls?
Just kind of like women's health in general.
When I was in nursing school, a very long time ago, OB and Gyn were my favorite. And so my first job was overseas, and I was assigned to a labor and delivery, postpartum recovery area, and I loved it. I just enjoyed it so much. And then I got to work with some of the gynecologists who were doing surgery, and it came easy to me. Don't give me cardiology, don't give me ortho, but give me women's health, and I can fight my way out of a paper bag very easily. So it's just something that came naturally. And then I was fortunate to work for 17 years for a gynecologist in California, and he was a great teacher. So when I went to nurse practitioner school, I actually taught OB-GYN to my classmates because I had so many years of experience.
Yeah.
And then he hired me back as a nurse practitioner, and so I worked there for many years.
That's crazy. So how did you end up at NAU?
Another long story. I moved here in 1995, moved to Flagstaff from California, and I was just done with California. For many reasons. And I had a variety of friends here, many who are still here, and I did a road trip, and I stopped in Bullhead City, no thank you. Stopped in Prescott, no thank you. Went to Phoenix, said, oh no. And landed up here with a friend, and she took one look at me and said, you're moving to Flagstaff? And I said, yeah, I know. And so I came.
Perfect, that's awesome.
I've been here for over 30 years, so.
At least you're liking it.
I love it here.
Yeah, Flagstaff is amazing. So how can we like ensure pursuing a better education for young women in order to like discuss multiple options within the healthcare industry for them?
Well, I think talking with your healthcare provider is the first step, because we can't rely on schools and parents to really A, have the knowledge, and B, have the ability to provide a method that's going to work for this particular woman. So one of the things we're doing with Days for Girls is working with schools in the county, and we're slowly making headway to get a better sex education program going. And the Days for Girls curriculum is just one start. That's just the first step. But then again, while I don't, quote, teach it, if there are questions, I will answer.
You will answer it. Yeah, of course. So how would you say, I'm trying to think right here, how would you go about, so say that they don't have a like primary care doctor to discuss this, or like they don't have like someone to like really lean on, how would you go about that, just hoping they can teach it in school?
Well, schools, I think, are really our best defense.
Yeah.
But they have to be interested in providing quality information. So that's one big hurdle. Certainly talking to classmates, I know you girls all talk. And many times I would get a young student come in and say, my girlfriend has a IUD and I'm interested. Okay, let's talk about IUDs. And then just because for a 17-year-old freshman, the idea of an IUD being placed in her uterus when she's not sexually active is kind of a big ick. So then we would talk about Nexplanon, which is the little rod that goes in the inner arm. Talk about non-hormonal methods, condoms, female condoms, diaphragms, flex discs, there's several. And make sure that she understands Plan B before she leaves that room. And she might not make a decision that day, and that's okay.
Do the nurses at school, are they pretty well educated on?
The school nurses? There's so few of them, I don't know how I'm sure they can pull it out of their hat. But it's not really their purview.
Expertise, I see. So what would the differences between hormonal versus non-hormonal methods of contraceptives be?
So hormonal contraceptives generally are estrogen and progesterone, or a progesterone agent, and there's many of them, as a single ingredient. So if you're looking at long-term birth control, like the Nexplanon, the Mirena IUD, they have a little bit of a progesterone-like chemical that served birth control. And what happens is it thickens the cervical mucus, so sperm can't quite get up there. It also alters the lining of the uterus, and it suppresses ovulation to a certain degree. That's just with progesterone. So Nexplanon is etonogestrel, and I forget what Mirena has, but it's a progestational agent.
Okay.
If you have estrogen and progesterone together, there are no devices that have that, but that's what birth control pills are. And they have estrogen and progesterone in a cycle, so you have a light period at the end of the cycle, which you really don't even need to have.
Yeah.
There's also Depo-Provera injections, the shot, and that's only progesterone. So those are the main ones that are hormonal. Non-hormonal, I always talk about abstinence.
Okay.
It is 100% successful. Condoms, diaphragms, cervical cups do not have 100% efficacy. And we have an old joke about what do you call people who practice the rhythm method of birth control?
I have no clue.
Parents. So natural family planning is kind of a pig in a poke. It works for some people, but you have to know your body really, really well. So for young women, we say, make sure you have condoms. Go buy some condoms.
Yeah.
And you need to provide them. If he's not going to do it, you're not going to do it.
I just feel like as a woman, going to the store and getting condoms is just like, that's like a man, quote unquote, a man's like job, you know?
I bought the first ones for my son. When he was becoming sexually active, he said at dinner time, I think I need condoms. I said, do you want to go like right now or do you want to go after dinner? He said, after dinner is fine. So we did.
At least he's open about it.
Very open.
Yes.
Yeah.
I just feel like that might be the issue too, because I think there's like a trust issue between like teenagers and their parents almost, because you know, you don't want your parents to look down on you, but you also don't like your parents, I don't know, you just like have that weird trust dynamic.
Well, obviously he trusted me.
Yeah, he trusts you.
He's now married, has two children, you know, and got a vasectomy. So he's like on board with all of this stuff. But when your mom's a nurse and is teaching prepared childbirth in the living room and showing videos of live birth, it kind of came naturally.
Yeah.
But not everybody is comfortable talking to their children. My granddaughter just started her period, and I was on the phone with she and her brother, and I said, Avery, did you read the book I got you about periods? She said, I did, and I already started my period. Like, it's no big deal. Okay? So, but they also live on a farm. They have seen mating behavior. They understand when a dog is in heat because they have 3. They've seen live birth. So it wasn't really a puzzle. And the more we don't talk about it, the more we get embarrassed.
Yeah, I feel like when it was introduced within my high school, I feel like it was kind of like a, oh, we just have to take this course just to take it type deal. So we like took this 1 hour education class and it barely discussed anything.
It's not enough.
It's really not. And then you go home and you're like, so like what's the next step? And it just kind of leaves people wondering like, what do I do now?
Right. Now NAU used to, and you might want to look this up and see if it's still there, but on the Campus Health website, they had a birth control website where patients could read through the website. And that was always another leading question when I would see students on campus, have you visited our website? And most of them said yes. So they had a little bit of background, and that was a perfect lead into what method are you interested right now? Let's talk about that. And I think the women I worked with made good decisions.
That's good. Would you say that, like, I wouldn't say it, but would you recommend hormonal methods more than non-hormonal?
I'd have to talk to the patient first.
Depending on what they're going on.
So estrogen has another contraindication, and that's a history of blood clots. So let's say you were in a bad automobile accident, broke your leg, got a blood clot, no estrogen for you. So we have to have the background. And then what's your life like? Or do you have a steady schedule where you can always take a pill? How do you feel about somebody inserting a rod in your arm or an IUD in your uterus? And some girls at 17, 18 are very sheepish about it, so pills are a great way to start. And it's in their control.
Yeah, be the best bet. Well, did you have anything else to discuss for the podcast?
No, I don't think so. I would like to see more sex ed in schools.
Yes.
And more comprehensive sex ed in schools. I know when we were up at Navajo, we had 9th through 12th graders, and when we got to anatomy and physiology, there were a lot of giggles around the penis.
Yeah.
You know, it's up on the slide, and I just keep talking.
Yeah.
Because they will get past that. But it's a very common response in young teens.
Yeah, I remember that.
Yes,
It's just like that immature age.
That image, like, oh no, I'm never doing that. Well, we all will at some point.
Yeah, just the whole boys are icky, girls are whatever, so.
Yeah, my 12-year-old grandson sort of has like a girl he's interested in. So, I mean, we've already had those talks.
Yeah, well, that's good. So recapping, when addressing topics like contraceptives to women, it's always important to approach with respect and empathy. You need to make sure to normalize the conversation without having stigma or any kind of judgment within family, friends, or even the patient or client. It's important to use clear and inclusive language, such as having discussion based off of age, cultural background, and knowledge level. As Wendy has said before, there are times where she has to kind of back up and really take a step back on how to address certain patients or clients based off of where they come from or based off of just the knowledge that they know. It's also very important to ensure privacy within the healthcare industry and counseling settings, so to always remember how crucial it is to have a safe place and space. It's also very important to have balanced information such as like pros, cons, and potential side effects of each method. As Wendy discussed, every method has its pros and cons and even different benefits for different women. There are times when some women are going to get declined some methods due to different health situations, such as any kind of history within the family health. It's also very important to support women without having access to contraceptives. As we all know, it's kind of difficult to afford such things such as Plan B. It can be on the pricier side, so it's always important to also reach out within your community and look at different places to really find a community within the community, such as having like access to, here in Flagstaff, we have the Coconino Health Department, and then we also have here on campus different ways to address your certain situations. Make sure to bring education and awareness between different natural methods. It's just also very important to just have free distribution within the contraception industry. I also just wanted to recap how important it is to have ensuring better education for young women, such as sex ed within schools. Sex ed within schools should always start at an age-appropriate and evidence-based program early on, especially within the high school career where everyone starts experimenting different things or are unaware. Looking at hormonal methods, such as pills, patches, injections, rings, implants, and hormonal IUDs, you need to make sure that they regulate or stop ovulation and alter cervical mucus. There are some pros which are high effectiveness, which can regulate periods and reduce menstrual pain, but there also are some cons such as mood changes, weight gain, or blood clots, which can be rare, but it's also very important to look into that family history. Some non-hormonal methods that she had talked about was including condoms, copper IUDs, diaphragmas, and fertility awareness methods. Some pros for that will be no hormonal side effects. Some protect against STIs, but some may also not. There also are some cons which can require consistency and may also be less effective without perfect use. This can be based off of how busy your schedule is and so on. I also just wanted to have a little definition on some things that we talked about within our podcast earlier on, such as progesterone and estrogen. So estrogen is also primarily responsible for the development of female secondary sex characteristics such as breast development and hip shape. It's one of the crucial roles within menstrual cycles, such as stimulating thickening of the uterine lining in the first half of the cycle. And then progesterone prepares the uterus for pregnancy by further thickening the uterine liner after ovulation. If pregnancy occurs, the levels remain high to support development of the embryo and prevent further ovulation. These are mainly the two hormones when looking that support pregnancy as well as menstrual cycles. I also think it's kind of important to talk about why it's an ethical issue. So here, sexual education is a bioethical issue based off of the range of sensitivity, such as ethical, cultural, and human rights concerns related to bodily autonomy, health, privacy, and also access to information. And here's just kind of a breakdown of that. So autonomy, as you may or may not know, is also kind of informed consent. Some ethical principles is just having everyone be able to have the right for their body, making decisions about their health. When it looks at sexual education, it kind of just empowers individuals, especially teenagers within this age, with the knowledge that they need to kind of understand what consent is, what contraception is, and their sexual and reproductive rights. And withholding education, it may be seen kind of denying the autonomy aspect within making informed decisions or choices, because there is no proper way to teach sexual education, or just it's kind of lacking within society as a whole right now. Within the Justice and Equity Division, it's kind of just sex education. It's kind of uneven across different regions, based off of different states or culture or even religion. Some people may not have access, especially if they're like LGBTQ youth or just different fairness and equal opportunities based off of their community. Sex ed interacts with deeply held values and beliefs, which can also create conflict between ethical standards such as health rights and cultural norms, causing regards to cultural and religious sensitivities. It depends on what age they're taught, or if they have parent consent, or institutions have control over the content. Kind of just an overall of like what public health versus individual parental rights are. It's kind of a balance between public health goals such as reducing teen pregnancies or STI rates with individuals or parental rights. The ethical challenge is basically how do we protect the public well-being while respecting rights within families' autonomy or diverse belief systems. Overall, the balancing rights and health within sexual health education kind of just needs to be found within a respectful and middle ground between providing accurate health information that's not just the basic what is sex or what is an STD. It needs to be kind of more in depth between women and men and what can be prevented or how can we ensure that they're giving the best education there is, especially with all this age-appropriate content that includes consent and contraceptions and STIs and healthy relationships and boundaries. I think it's just important to understand that they're also at the age to ensure that public health is what needs to be taught within a bigger picture. It's just balancing the rights between sexual health education, such as inclusion, empowerment, and collaboration. The goal isn't to push one view, but to just make sure that they're having safe, informed, and respectful choices. But that's all for this podcast. I want to thank Wendy for her time and input on everything. It's been a pleasure meeting. And that's going to be all for today's podcast. Make sure to keep your eyes and ears open for our roundtable, which will be our final podcast within the episodes. So thank you all for listening.